A recent nutrition study sought to answer a provocative question: is omega-3 fatty acid consumption connected to life expectancy? Answering simple questions regarding food intake and chronic disease or mortality is, well, rather complicated. With various elements at play in determining how long a human may live, it's crucial to remember that factors other than food do influence. Exercise habits, smoking, drinking, and sleeping patterns all have an impact on an individual's overall health. However, diet has an undoubtedly large impact on your health, and as you focus on your non-diet health practices, we're here to break down the most recent nutrition facts. Welcome to today's episode of Longevity News. In this episode, I will talk to you about and show you all the amazing health and longevity benefits that omega-3 and fish oil provide and all the studies which have been conducted around it. Omega-3 fatty acids are nutrients obtained from food, or supplements, that aid in the development and maintenance of a healthy body. They are essential to the construction of every cell wall. They also serve as an energy source and aid in the proper functioning of your heart, lungs, blood vessels, and immune system. Two important ones, EPA and DHA, are found largely in specific fish. Another omega-3 fatty acid found in plant sources such as nuts and seeds is alpha-linolenic acid. Let's start with the basics. What exactly are omega-3 fatty acids? Omega-3 fatty acids are classified into three types: alpha-linolenic acid, icosapentaenoic acid, and docosahexaenoic acid. Alpha-linolenic acid may be found in plant oils such as flaxseed, soybean, and canola. Fish and seafood have high levels of icosapentaenoic acid and docosahexaenoic acid. 1 omega-3 fatty acids are found in the membranes of your body's cells and, regrettably, cannot be produced by the body on its own. As a result, omega-3 fatty acids are referred to as essential fatty acids. Omega-3 fatty acids provide several health advantages, the most well-known of which being cardiovascular protection. Omega-3 fatty acids have been linked to a lower risk of cardiovascular disease, blood clots, and inflammation in studies. They help to maintain the lining of the arteries glossy and smooth. Yes, that is a persona-declared scientific statement. But they really do. According to the latest omega-3 fatty acid research summary published on Science Daily, increased levels of omega-3 fatty acids in the blood can extend life expectancy by around 5 years. Researchers have discovered that omega-3 levels in blood erythrocytes are very good mortality risk indicators, according to the report. Data from a long-term research group were utilized in the study, and finds that having greater amounts of these acids in the blood as a result of routinely eating oily fish enhances life expectancy by nearly 5 years. To summarize, omega-3 levels in red blood cells are excellent indicators of mortality risk. The study's author, Dr. Alex Sala-Vila, also adds that smoking reduces life expectancy by roughly 4.7 years, which is offset by an increase in life expectancy if your blood has high amounts of omega-3 fatty acids. This new study followed 2,240 patients over the age of 65 for an average of 11 years, indicating a high-quality study with a large number of data points. Dr. Sala-Vila wishes to persuade the public that it is never too late or too early to make these changes. Several significant studies have connected greater levels of long-chain omega-3s in the blood to an increased risk of prostate cancer. Other study, however, has indicated that men who eat seafood often had reduced prostate cancer mortality rates and that dietary intakes of long-chain omega-3s are not connected with prostate cancer risk. The rationale for these seemingly contradictory findings is unknown. Fish oil supplements are the most often consumed non-vitamin, non-mineral natural product by both adults and children, according to the 2012 National Health Interview Assessment, which included a thorough survey on the use of alternative health treatments in the United States. According to the results of the poll, around 7.8% of adults and 1.1% of children aged 4 to 17 had taken a fish oil supplement in the preceding 30 days. Although omega-3 fatty acids have potent anti-inflammatory qualities and can reduce blood fat levels, the mechanisms behind these actions remain unknown. Omega-3 appears to have a direct influence on biological aging by decreasing the pace at which protective caps on the ends of chromosomes shrink, according to new study. Telomeres are caps created from replicated strands of DNA that operate similarly to bookends or the plastic ends of shoelaces. They maintain the DNA organized and confined by preventing the ends of chromosomes, the packages of DNA in the cell nucleus, from getting damaged. Telomeres shorten with each cell division until a crucial threshold is reached. The cell's DNA is then damaged, and it stops dividing and may die. The telomere functions as a biological fuse in this way. Individual persons and individual cells have different rates at which the fuse burns. This is thought to have an effect on disorders associated with old age. The researchers studied the effect of omega-3 fatty acids on telomere shortening in 608 heart disease outpatients at a hospital. The length of chromosomal telomeres in the patient's white blood cells was measured at the start of the trial. The omega-3 fatty acids docosahexaenoic acid and icosapentaenoic acid were also tested in the blood. The tests were repeated after 5 years and revealed a strong link between omega-3 consumption and health. The patients who consumed the least omega-3 had the fastest telomere shortening, whereas those who consumed the most omega-3 had the slowest. The present findings identify deceleration of telomere attrition as a potentially novel pathway for the anti-aging effects of marine omega-3 fatty acids, the researchers wrote in the Journal of the American Medical Association, led by Dr. Ramin Farzaneh of the University of California at San Francisco. In a nutshell, red blood cell omega-3 levels are excellent indicators of mortality risk. The study's author, Dr. Alex Sala-Vila, also points out that smoking reduces life expectancy by 4.7 years, compared to an increase of life expectancy if your blood includes high amounts of omega-3s. Including omega-3 fatty acids in your diet is simple, we promise. The American Heart Association suggests eating oily fish twice a week, such as salmon, anchovies, or sardines. 3 If salmon, anchovies, or sardines aren't your thing, here's a list of omega-3 rich alternatives, including vegan options: trout, carp, herring, omega-3 fortified eggs, flaxseed, walnut, pumpkin seeds, chia seeds, hemp seeds and green leafy vegetables. Try Persona's omega-3 supplement if you don't receive enough omega-3 in your diet or wish to enhance your omega-3 consumption. Each easy-to-swallow capsule of Persona's omega-3 includes 500 mg of marine oil. Persona also provides omega-3 with BioCurc, which contains 200 mg of curcumin to help with inflammation. Try Persona's vegan DHA if you eat a vegetarian or vegan diet or have a fish allergy. Both EPA and DHA are found in fish oil. Algae oil contains DHA and may be a useful alternative for persons who do not consume fish. First, consult with your doctor about using a supplement. Depending on your health and the other medications you take, they may have special recommendations or warnings. Omega-3 prescriptions are also available. DHA, EPA containing medications such as Epanova, Leveza, Omtrig, and Vascepa are suggested for people with triglycerides of 500 mg per deciliter or above. Unlike fish oil supplements, these drugs are licensed and supervised by the FDA for quality and safety. Fish oil contains both the EPA and DHA. Algae oil includes DHA and may be a good replacement for people who don't eat fish. First, talk to your doctor about taking a supplement. They may have particular recommendations or cautions based on your health and any drugs you are taking. Prescriptions for omega-3 fatty acids are also available. For those with triglycerides of 500 mg per deciliter or more, DHA, EPA containing medicines such as Epanova, Leveza, Omtrig, and Vascepa are recommended. These medications, unlike fish oil supplements, are regulated and overseen by the FDA for quality and safety. That's why it's so important to check with your doctor before you take omega-3 supplements, especially if you take other medications or you have health issues. In the case of ADHD, some studies show that fish oil can reduce the symptoms of ADHD in some children and improve their mental skills, like thinking, remembering, and learning. But more research is needed in this area, and omega-3 supplements should not be used as a primary treatment. Or with Alzheimer's disease and dementia. Some research suggests that omega-3s may help protect against Alzheimer's disease and dementia, and have a positive effect on gradual memory loss linked to aging. but that's not certain yet. In conclusion, there was an inverse connection between baseline blood levels of marine omega-3 fatty acids and the rate of telomere shortening over 5 years in individuals with stable coronary artery disease. These findings suggest that omega-3 fatty acids may protect individuals with coronary heart disease against cellular aging. If you're thinking about taking omega-3 supplements, talk to your doctor first. If you're pregnant or nursing, using blood-thinning medication, allergic to seafood, or thinking about giving a kid an omega-3 supplement, talk to your or your child's doctor. So, what is your opinion and experience with taking omega-3, either through natural means or through supplements? Have you seen any of the benefits mentioned in this video, or has nothing really happened? Please tell us your opinion in the comments section below. I would love to hear what you have to say about it. Thank you for watching Longevity News. We consistently report on the newest biotechnologies and supplements around longevity on society's path to curing aging. Please support our cause by liking this video and subscribing to not miss out on any new videos.